delighted to be here. Affordability is not an India-only problem. In the UK, so I'm from the UK, where we have the National Health Service. It's one of our great institutions, and the current budget is about £110 billion a year, which I think is probably about 150 billion US dollars, roughly. And partly because of our financial constraints, because we've been through a long recession, partly because of rising demand, partly because of the growing age of the population and growing morbidity, we are having to save somewhere between 20 and 30 billion pounds over the next 3 years, and that's maybe sort of 40-ish billion US dollars. So that's quite a lot of money. That's about 25% of the overall budget. So this is a worldwide problem. It's not a UK only problem. And I think perhaps the tendency for industry historically, and I'm talking over the last many decades, has been certainly for medtech, which is my main area of work, for devices, in particular devices, they just get a little bit smaller every time, and they get a little bit more expensive every time. And so, what I think the real challenge now, you're not gonna pull big money out of developed economies' healthcare systems, and you're not going to build a sustainable system in a country like India by having that model. You need a completely new model. What we've done at NICE in response to that is we've set up a completely new way of evaluating medical technologies. And what we accept onto this program, which is our Medical Technologies Evaluation Program, is medtech products where the company's claim is that the product is clinically non-inferior, but that it releases resources from the system. And so we have a way at NICE of evaluating with evidence, with clinical evidence and with economic evidence, to actually demonstrate whether that's the case. And if that is the case, then the product will be recommended for use in the health service. And that's a completely new type of evaluation. There isn't another body in the world that is doing that. There are all developed countries will all have organisations like NICE or similar to NICE. But we are the only one that is actually doing this. And we're doing this because medtech is incredibly good at releasing resources from the system. You have maybe an implantable that you implant, and then it means the patient no longer has to take drugs, or you can develop a device which means that perhaps instead of having a doctor administering the care, you can have a cheaper grade of staff administering the care, or you might have a device that a patient can use at home. So there are so many possibilities in medtech to really meet that affordability challenge. And we completely in response to this challenge, that's why we developed this new way of working at NICE. If you're in a situation like we are in the UK, we are trying to provide a sort of comprehensive national health service. Although there are some interventions that are extremely cost effective, like advice on stopping smoking. You get extremely low cost per quality, but actually you can't spend all of your healthcare budget just on one thing. So I think the issue is about being able to provide a comprehensive range of service, looking across the whole lot, and really just being very much focusing, and you expect me to say this because I come from NICE, very much focusing on where there is good evidence that things work, and if there are areas that need more evidence, that really using your absolutely top class research facilities here to build that evidence. Because I've been a payer as well as now working at NICE, and you want the evidence to persuade you to spend the money. And maybe what's lacking in some cases in the sort of policy areas is people having a certitude that if they really spend that money in that area, they're really going to get good value for it. So it's not just about spending the money, it's about producing evidence to show that it is a good spend too.
So prioritize where the impact is the
I
highest.
think so. Yeah, I think so. But you can't, you can't only do that, because you've kind of got to provide. If you're a government, you've kind of got to work for everyone. But obviously, you're going to have some things that are very high priority, and immediately saving lives is normally very high priority.
Right.